This month, we continue bringing attention to breast cancer with cases on the rise among younger women. It is something that survivors say is not talked about enough. Having a baby after. Doctors say preserving fertility is now helping women's path to parenthood.
When a patient is sitting in a doctor's office and hears the word cancer, they really don't hear anything else after that. And so to talk about fertility preservation or future family building is really not something that they're prepared mentally and emotionally to tackle in that moment.
Dr. Carolina Sweldo is a double board certified fertility specialist and founder of Sabo Fertility Center in Fort Lauderdale. She says it's a conversation she's having with women diagnosed with cancer, technology that wasn't readily available or talked about even 15 years ago.
We know that any chronic illness can potentially be a risk factor for infertility in the future. So it would make sense that cancer would fall into that bucket. But separate from that, really what we worry about is the exposure to chemotherapy and radiation.
At the time, I was single. And I wanted to get married. I wanted to have a family.
Lorena Bowling was diagnosed with early stage breast cancer at 35. The diagnosis forced her to think of something she hadn't thought about.
It all happened so quickly. I never thought about preserving my eggs. Even at 35, I just thought I'll just get pregnant later in life.
Lorena worked with Dr. Sweldo to freeze her eggs. Dr. Sweldo says it's a multidisciplinary approach working closely with the oncologists who are treating the cancer. It involves either egg freezing, sperm freezing, or creating embryos. And there are factors to consider.
Age, pregnancy history, the type of cancer. So if the cancer is in the ovary and there's a potential for possibly what we call seeding or spreading of the cancer, that may also play into our likelihood. And then also how aggressive is that cancer? How quickly are they willing to start treatment?
The process of egg freezing can roughly take 2 to 3 weeks and done before treatment. And while it's not a guarantee, Dr. Sweldo says for patients under 35 with a reasonable number of eggs, the likelihood of a healthy birth is well over 50%. Lorena says the process is arduous and exhausting, mentally and physically. That involves injecting hormone shots into your abdomen to help the follicles and eggs grow. Nearly 5 years later, and Lorena is now married and in the process of building her family with her husband, whom she met during chemo.
And he just grabbed my hand and said, you know what? That's okay. I think you're going to be okay. And he became my husband.
Yeah, and there's so many layers and different scenarios for this topic, but if anything, we hope that this helps young breast cancer survivors feel seen on a conversation that isn't spoken of. And of course, preserving fertility is done for non-cancer patients as well.
Especially, as you said, we have been seeing these cases in women younger and younger, but women watching this right now saying, you know, is this safe? But we heard hormones many times in there, especially when it comes to hormones.
Yeah, and that's what I asked her too, because some of these cancers are sensitive to hormones. And she said right now there is robust data that the short-term exposure does not lead to an increased risk or long-term risk for a patient. So that's encouraging news. But of course, you know, talk to your doctor, of course.
Have that conversation. Thank you for that. All right, let's go ahead and switch gears.